Typically, we do around 10 to 15 bifurcation cases and complex PCI in a month. Challenging side branches are not that frequent. Most of the time, it can be managed with conventional gadgets. Maybe out of these 15 cases, 5 may be challenging. Side branch protection is mainly done by keeping a wire inside the side branch. Side branch expansion all depends on the stent quality, stent profile metrics, and the bed preparations. If the bed preparation is good, most of the stents can expand to the desired MLA or MSA, but sometimes it is impossible to achieve the ultimate expansion in spite of doing everything. So I would say in 95% cases, imaging based side branch treatment is the ideal one. Missing the side branch ostia is a problem in many challenging situations if you are doing without imaging. Knowing the ostium is important, the angle is important, the calcification at the ostium can pose a real problem of missing the ostium. So side branch access, side branch imaging, side branch stent technology, stent design, all are important to have long-term better outcome in side branch mess. In side branch stent, if it is very long stent, then stent flexibility and stent design is very important. Most of the time it is pushable and most of the time it is less than 30 millimeter, I would say. But again, the stent recoil definitely is very important, especially if you have very tight ostial stenosis, fibrotic lesions, bad angle, and a calcified ostial stenosis is really challenging sometimes. Ostial, these are the situations where the stent recoil is very important. Side branch expansion all depends on through which cell you are going into the side branch after putting a stent, pot, kissing, gel, etc. But the most important stent design, the cell diameter, the cellular axis design, and the cell perimeter of the main vessel. Dedicated side branch stent is out of fashion, but if you have a stent which will protect the side branch as well as the main branch, definitely need a long-term outcome trial through which will come to know that it is superior than conventional way of treating side branch. Side branch, if it is of 2.5 and above, and it's very important branch, long branch, for example, single diagonal or side branch like circumflex ostia, long sinus, long circumflex, or any other side branches, the long-term outcome or mess all depends on how do you prepare the side branch, bed preparation. But nowadays, most of the side branches are treated with a drug-coated balloon. On the table, the TB flow is very important. The expansion is important. The image guidance is important. Ultimate MSA or MLA you achieved on imaging is very important. So not only TB flow, other imaging features, MLD max is also important for main branch and stent distortions and the final ML and MSA. Most of the time, if it is not circumflex, it does not translate into cardiovascular death. It only translates into recurrence of angina, and many times these are asymptomatic occlusion if the side branch is of small size and short in length. So usually if it is not acute, side branch occlusion is gradual over the time. This does not kill the patient as such, but it can definitely hampers the quality of life and the recurrence of angina. As I said, dedicated side branch stent has been there for quite some time. We have tried, but it is little cumbersome. The new design is helpful, but the drug-coated balloon has killed the dedicated side branch stent. Newer data, if you have a side branch of significant size and diameter, the area of the myocardium supplies more than 10%, and if that side branch is occluded or restenosed, that can translate into LV dysfunction, recurrence of angina. So side branch is important only when these parameters are of significant size and diameter and matrix, but protecting a side branch is basically done by keeping aware, and most of the time it is a basically provisional stenting. But if you have true side branch, true bifurcation lesions, side branch protection, side branch treatment, and better final result is important. Now, stent design which is dedicated for side branch protections, definitely a welcome thing.